My name is Crystal Bauer, and I am the manager for the Center for the History of Family Medicine. Today is September 13th, 2021. Kay, could you please confirm for the record that you are aware that this is being recorded and that you are giving your permission to do the interview?
Yes, and yes.
All right. Would you please give your name in full?
Yes, so I'm Dr. Kay Durst.
And what is your present title?
So I'm a board certified family physician.
And going farther back, where did you attend medical school?
So I graduated from the Medical University of South Carolina in Charleston, South Carolina.
And where did you complete your residency?
So I did my internship actually at University of Florida at the Coral Springs and Fort Lauderdale area. And then I did my other residency at University of Miami down in Miami, Florida at Jackson Memorial Hospital.
So you stayed in the state of Florida
Yes.
for that.
Yes, for a while
Okay.
actually. Yeah.
So when you finished your residency, could you kind of tell me what the world of family medicine was like?
Yeah, it was definitely different than it is now. Some things were similar, but some things were different. I'm in the older school. When I got out, we were still all paper charts. So that was very different. We had a few computers, but not many, just a few to very remotely get a few labs. So that was very different than it is now with electronic medical records and even us doing this call through like a
Yeah.
Zoom WebEx. So that was different. Also is different in the sense that back then there were no hospitalists. So family medicine doctors were the hospitalists. So when I got out, I would go to, if my patient was in the emergency room, I would admit them from the emergency room. I would follow them the whole time they were doing there in the hospital. If my patient had a surgery, let's say a replaced hip, I would be the one consulted on the surgery. I'd follow the patient after they had the surgery and all the way through. We also did a lot with hospice in the hospital. And of course, now you have physicians that our hospitalists and our hospice doctors, and some of the doctors do a lot. But I think that's one of the biggest things. Oh, and of course, we did some house calls too. So I think that's one of the biggest things with the new physicians now that it's 2021, they're coming out, or doctors realizing they're hospitalists or ER docs and things. And it was very different.
Yeah, it sounds like that. Would you say telemedicine kind of brings back, those home visits in a sense because you're kind of seeing kind of the patient's environment at
Yeah.
home, or probably not the
Yeah.
same, but
Yes, no, I love it. I actually did telehealth for 3.5 years before COVID. So this is my fifth year of it. And I'm a third generation family medicine doctor. So actually at the practice where I am, my grandfather started it. So it's been around for 78 years. And so as a kid, I used to go with my father and my grandfather, and my father's a family medicine doctor also, with them with house calls and all. And even myself when I started. And I think that was a great thing for family medicine because you would be invited to have the piece of cake and sit and you learn so much about a patient and the family. And so one thing again, like getting back to your question, that I have loved so much the family medicine, I mean the telehealth, is this family medicine. I see people's dogs and cats and kids and grandmas and what they're eating, and they'll show me their garden and where they are, and then I see where they, they're sometimes in their car or traveling, and so it's very interesting. But it brings a great aspect that's kind of fun, actually.
oh yeah, I bet.
Yeah.
Well, coming to the present day, could you speak on your current position and kind of what you do on a day-to-day basis?
Yeah, so I do practice family medicine. I don't go to the hospital anymore. I mainly practice outpatient. I don't see as many babies as I used to, but we see mainly like 6 years old or 11 years old up through 90 something years old. And we do a mix of telehealth. I also do a mix of just doing, like today, for instance, I did a couple of annual wellness exams through Medicare, which is mainly asking questions. I did a physical on top of doing some telehealth on just depression or mental health issues. On top of right now where I am, we are actually #1 in the United States for COVID, unfortunately, in South Carolina. And then so I had to take care of some COVID patients on telehealth. And then I had to set up a lot of people through telehealth to go get tested for COVID.
Wow, just a few things you do on a daily basis,
Oh
right?
yeah, it's
It's a
definitely
full
fun.
day.
I mean, you can't say, I always say you can't say you're bored. If you're bored, it's the wrong thing. So it definitely makes it challenging, but also interesting. On top of computer dying and staff out because of COVID and their kids out because of the schools. So it's definitely challenging.
Well, could you kind of speak to how COVID-19 has impacted patients' visits at your practice and maybe how this year's experience with COVID has is different from the onset of COVID last year?
Yes, well, it is different, and I can talk personally. I actually got COVID in March of 2020. I was one of the first physicians in our area, and so I was involved with, there wasn't testing, trying to get a test, being isolated, nobody knew about it. So I kind of personally went through it, which was very different and from now. Back then there was no treatment. Nobody hardly even knew about the disease. So that's different. Where of course now, thank goodness, in 2021 in September, we have the vaccines that we've had since December. I got my vaccine back in December. So that's very good, 12 and up. The testing is more widely available. You have the home test, which is great. I've had to use that on my family some just to make sure, but the gold standard's the PCR test. And now there are more places that you can get at the different pharmacies or at the schools or the different hospitals or the Department of Health. So that's been a very big change. And then we have some treatment with immunotherapy. But people are still, it's still a little, I mean, it's still kind of the unknown. We haven't studied it for many, many years. So seeing the patients, I think one of the hardest things is trying to talk to the patient. They say, oh, I just have an allergy. It's not COVID. I know it's not COVID. And trying to relay to the patient, and maybe, hopefully it's not, but let's test it while you're still trying to set them up for their wellness exams or their mammograms or whatever. Last year was a little easier in some ways because people were quiet and in their home. Now they're trying to go to their football games and be in the school and have regular life, but then you have this pandemic. So it's different for
Sure,
different reasons.
sure. Uh, with the pandemic, have there been any payment issues that have arisen for you?
I think for us, it's not as many. I know some patients have brought it up, but I think through the different companies, it's been good. I have seen, not necessarily through my practice, that we're with the hospital, but in the area, I'm starting to see some payment issues, some people, in the sense that people are starting to pay a lot of money to get tested, because if you go to the Department of Health or the other places that are free, now we're so busy again that is the lag time. So then people that want just the test to travel are paying $100 or $200 for it. So that's different. I also noticed that, before it was really good. We had a lot of setup to help, I felt, more protect the doctors for like telehealth and payments to help for especially our Medicare patients, our elderly that were trapped. They couldn't get out because of the order. There were some problems with the payments, for the physicians, and then they were able to compensate for that. Telephone calls, set up virtual visits, But now, unfortunately, because of the different regulations, and we're kind of out of the pandemic legally, but we're not really out of it, we're starting to
Right.
see some issues with that. Um, However, I know the Academy of Family Medicine and others have really pushed for that with the telehealth. And a lot of the patients now, they've been doing it for a few years, so they're more used to that or willing to pay for it.
Uh, Another issue last year was having access to testing and supplies. Did you experience shortages
Oh,
last year with
yes.
that?
Oh, yes. I mean, even going from myself trying to get tested because I knew I had to, no matter how careful I was through somebody, I knew that I was exposed and I couldn't even get tested. And then the testing, trying to figure out if it was false negative and then trying to scramble for that was definitely a problem. And then trying to get the personal protective equipment was even more of a problem, which is why we had more of the shutdown. Um, and even to this day, unfortunately, there's a problem. Like even now, the rapid test in our community, it's difficult to get because we have such a sheer number of volume of patients. It's just not set up for that. Our hospitals are very busy. We have over 200 and something patients within my little hospital area. No, I mean, within my hospital I work with, compared to other places. And that's just on top of the regular people. That's a lot of extra patients, 200, all with COVID.
Do
So,
you foresee those issues getting worse or better in the next few months?
well, in the next few weeks, I think they'll get better. Um, I think overall it's a little better. They're working on trying to get more of the home testing. I think as long as the supply and demand, well, the demand is there, supply is good. Excuse me. Then I think that hopefully you'll get better. Um, but for right now, it's a little difficult.
Sure. We talked about telemedicine a little bit earlier, but could you speak a little more as to how telemedicine has changed in your practice since the pandemic started?
Yes, I did telehealth for a couple of years beforehand. I always a big proponent of it because I thought it would be the way of the future. And since I experienced hurricanes and issues like that, other disasters, it's a way that you can reach out if you can get connection, or at least by phone to help with people. So get back to your questions, it's changed. So at the beginning, I would do a lot of telehealth to mainly talk about anxiety medicines or follow up. We wouldn't hardly do many sick visits, maybe a rash or something. Whereas, of course, now with telehealth, it's not always, but a lot of sick visits. But I think it's a great way to manage more triage. It's a way to get a doctor's expertise to triage. So I'll sometimes say, and they'll ask me like at the end of the day, it's 4 o'clock, so and so has a question. Can you put them on? And for that person to, get in their car, come to my office and be seen, then we're closed. I can't, but I'm like, let's do a telehealth. So I can assess the patient and then I can at least say, hey, this is limited. I can deal with it. Or, you know what, I advise you to come over to my office tomorrow. I think it could wait, or you need to go to the emergency room. The other way it's very helpful, especially nowadays, unfortunately, a lot of people think they can't believe they have COVID, even with the vaccine. So they want to come into the office. And it's a good way that we can also triage, to kind of follow up so they don't, infect us or our staff or infect our other patients. And that's
Sure.
been very helpful. I think some of the patients are having, they don't quite get it, but once you explain it to them, it's good. Another thing that I think is I have a lot of patients that are scared, right? They don't
Yeah.
want to come in or they're going through cancer treatments and they don't want to come to a doctor's office. It's full of other people. They want to stay at home.
Yeah.
So another great way that I use it is I can set up, I can see you, maybe I'm following your diabetes along with your cancer. So I can say, hey, Mrs. Jones, let's follow that, but we need to get some blood work so I can put in the computer. Let's get some blood work for follow your diabetes. Either I can have home health come do it, or They could go to the different labs in the area. I could even set them up to get their mammogram or their bone density tests or x-rays. So there's a great way, instead of that patient being behind on their preventative wellness, we could do that. Let's say they even cut themselves, and then I look on the chart and say, hey, you need a tetanus. Come over, let's just give a quick tetanus with the nurses or get it at the local pharmacy.
Yeah. Can you kind of describe how the vaccine rollout was in your practice in your area and how your patient's reception was to the vaccine?
Yeah, so we got ours mainly through, of course, the healthcare workers, the frontline workers are the first ones to get it, thank goodness. And that was in our area in December, into December and January. And so that was great. And of course, you got the one shot and the other. And then the reception, and most of the people in the area, especially the elderly, because at the time the COVID was more focused on getting the elderly sick, where it wasn't
Right.
affecting as many of the young people in general. So when it first came out, a lot of patients wanted to get it, but it was not very easy to get the vaccine. People were lining up for hours. I even myself, for my own family members, even though I'm a physician, I spent hours trying to book appointments for them. It was like you hit the jackpot if you got it. You're like, oh my gosh, you got a vaccine place. People
Yeah.
drove hours to go find a pharmacy that would get it. So it was definitely a issue. And then as time went on, became more available. Actually, after, first we had Pfizer and then the Moderna and then the Johnson Johnson. So as this became more available and they were more at the other pharmacies, it was easier to get. Now and then you had the other wave is when it was recommended for 12-year-old and up, because first it wasn't for 12-year-old. So when that happened, that was a whole nother wave. That was like in April or May, of everybody trying to get not everybody, but the age limit, age group, excuse me, trying to get it.
Right.
And it was still hard to get. And then a lot of questions about it with the kids and all too. And then as people were getting it, there were very few side effects, but some people had side effects. So we learned about that. We learned about the vaccine causing some lymph node involvement that could cause abnormal readings that were not true abnormal readings, but false readings and mammograms. So we talked about that. But I guess the biggest thing now is then right at the beginning before the school year in the summer before our next wave. So this is our third wave as I'm talking now, is that the vaccine, we almost had a lot of vaccine, but we still had we still have a big group, especially in my area. Unfortunately, it's probably about 50% are not vaccinated. We had some availability of it. Now, as this new Delta variant is coming along, we're getting more of the resurgent, and there is a little bit more people getting the vaccine. And now, actually, this last week, we're starting to get the talk about getting the booster of the vaccine, so getting the third vaccine, and that's a whole nother ball game. Looking at whose criteria, who meets it, who gives it, what's your criteria. So that's an interesting. It's definitely changing, but that's
Sure.
interesting.
Sure. I'm sure your answer would be different if I asked you this a year from now, too. I
Oh
mean,
yeah,
it's
exactly.
an evolving question for sure. So,
Yes, it always is, and especially as we go forward with the booster, um, for immunosuppression, and then the elderly, and then a lot of healthcare workers want to know. Then we look at, obviously, did COVID, do you have the antibody? Do you not have the antibody? What does that mean? Is the Delta variant, this mu variant? So it's definitely every day it's changing. And then now looking at the kids, are the kids going to be able to get the vaccine?
right.
Um, and I think one of the biggest thing is the challenge of the vaccine, at least the Pfizer one, having to be frozen, getting it 2 shots, that has come into play also.
Sure. Sure. Well, big question. Could you describe how COVID-19 has impacted your current position as a physician?
Yeah. Oh, how has it impacted? Yeah.
Yes.
A lot. I mean, it's definitely changed the way we practice. It changes, we're all humans too. We all have families and friends, and, we're involved in social media and see the news, and that's a whole nother ball game. So that's very disheartening. It's also impacted a lot because uh, most all doctors really, we promote vaccines, we promote hand washing, we promote the public health. And it feels like sometimes you have to fight against the trying to get people to get the COVID vaccine that could save their life. So that's very exhausting, I guess, in a way. So your day is very different than even in the past when you would be seeing a regular, just their patients, then now you have this added layer. Every patient you see, you talk about the vaccine or COVID and talk about the anxiety and the mental health and the school. So it just adds another layer that's affected everybody.
Sure.
So, um, I think it's been also nice. Some good things like this program, I'm glad you guys are doing this. Thank you. And I think it's important to look at history and see what can we learn from this? How can we make things better? And I think there are a lot of great things in the end that have been made for the better. And I think it has changed medicine in some ways for the better.
Well, that kind of brings me to my next question on how you see COVID-19 changing the profession of family medicine.
Yeah. Well, I think a lot of things. I mean, I think a lot of the physicians in itself and healthcare workers, but since we're talking mainly about family physicians, saw where last year for a while, a lot of people were applauding all the healthcare workers, everything they're doing. And that lasted for a little bit. But here we are, a year and a half still into it, and we're even worse into it, at least in where I am, than we ever were. And we have some great tools to help us, but we're also fighting this big tidal wave. Um, but we don't necessarily get all the cheers that we used to, and the people every day bringing us lunch and all. So I think that's hard, and it's frustrating when you have something, a tool, the vaccine that could help, and masking, and it's become such a division in this country, and that's been very challenging. um, and I think about for family medicine, some of the ways too. We still want to be there. I think some of the autonomy is getting used to, like, I'm not used to people testing for something at home, right? Like they now
Yeah.
test for COVID at home. And are they doctors? Are they interpreting it right? Did they do it the right time? I think that's very different. Now you can go to your local pharmacy and get a test, or some group comes in, a nurse or somebody just comes in the house and tests. The schools test now for that. And they're not testing, they're testing for strep and flu and all. So that's very different, where before it was kind of in the sacred house of the physician's office. And so that's kind of strange. Vaccines in and of itself, I mean, before you heard, I mean, right before the pandemic, of course, you could get certain vaccines at pharmacies and all, but now that's very different. I mean, even at my own practice right now, I don't give the vaccine because of several reasons. I know a lot of family physicians across the country and the world have set it up, but we don't. Now we hopefully in the future will have it, but that's a big difference,
Sure.
also. Um, but in the same time, some good things that I still think it's important, and I hope, and that's one reason I'm doing this interview and trying to get out, is that we want to get more word out with family physicians or physicians in general, but especially family physicians or pediatrics or primary care that are on the forefront, to get the word out of how to stop this epidemic and how we can help in the future. I think it's looking at also too the high risk factors of diabetes and high blood pressure, what has made people sick. Now,
Yeah.
some person could be healthy and still get COVID and die, unfortunately. But in general, we found that the people who've had more complications are the people with other chronic diseases.
Sure.
So if anything, I think that's also been good. I've had more of my patients realize that, hey, they got the COVID vaccine, but they don't want to get a chance. So they're going to work on their diabetes and lose weight and focus on wellness.
Yeah.
And that's been a great plus, looking into it. And I think for in the future, as we go further with public health and all that, I think hopefully, more people realize like the doctors were telling the truth. We were there.
Yeah.
Um, so I think that's important. And a lot of family physicians are hospitalists. I mean, they are really there on the front lines,
Yeah.
in the emergency room, in the place. I mean, we do a lot of urgent care, but I'm not at an urgent care center.
Yeah.
I'm in a hospital. So they have a whole different perspective. Mine's from the
Outpatient. Yeah.
outpatient side. Um, but I think that's a difference too. I think a lot of the hospital administrators and all are hopefully, at least a lot of the ones I think are doing more good, are realizing one, what's your greatest asset? Your greatest asset in all healthcare is is a physician, a leadership in the health field. We have to take care of the health. It doesn't matter who you have. If you do not have physicians, then all of us are sick and going to die. So I think that's very good to recognize that. I also think because of the issues with the COVID and the chronic diseases also brought about mental health issues amongst everybody, but really look at the mental health issues of physicians. And I'm very big on trying to get wellness for the physicians. If we have to take care of ourselves and our own people and look at wellness so we can go back out there and take care of others. We have to make sure we have the sleep and make sure we take care of our diabetes and lose weight and exercise and mindfulness. So kind of, eat healthy, limit alcohol. And I think that's kind of been good. We've all kind of been in it together. But I see that kind of as a moving, kind of target.
Sure.
I
Sure.
also think that more family physicians out there getting the word out, doing interviews, writing. I think some people don't really realize what a family physician does. I think even some of the specialists, they know what they do, but don't realize that we are really on the front lines taking care of all that. And especially true family physicians that don't work in our urgent care, I can suture up somebody. I can do a fracture. I mean, I can take care of your whole family. We could do all that. And that's what's great about family medicine. I mean, I don't, but some of the family medicine doctors deliver babies and,
Yeah.
do different procedures. And that's what's great about family medicine.
Sure.
We're trained in so many aspects and we're very fluid and we can change and we can work with policymakers. We can do the mundane. We can work with different things. And I think also, I hope that this technology, which I'm very excited about, the innovation. There's so much technology, that we're doing tonight, telehealth. I have patients that I follow with COVID, check their own pulse ox at home. So I manage their pulse ox and do the labs, which before you would never think to do that. But as soon as they get out of the hospital, they just need somebody that knows the knowledge and can figure it out and talk about it and kind of a leader. And I think that's very exciting. Also, we have a lot of innovations coming up with, glucose meters and blood pressure meters. And I know the technology is there. I know that the physicians are there. What we need and what we're working on kind of goes back to your first question, Crystal, with the cost and the payment. I think doctors would be more willing if you pay us for a phone call and the emails and refills and all. We will be there. We have a lot of knowledge, especially even if you just got out of school, but especially the physicians that have been around for a long time. I think it's the knowledge and the wisdom that we could take, or doctors that have been through maybe the army doctors through a war, the doctors, maybe like myself, they've been through several hurricanes and several disasters or flooding or whatever. You can apply a lot of the same principles to pandemic.
It's interesting you say that actually, because one of my prior interviews, the doctor spoke a lot of the AIDS epidemic and how his treatment of that, those skills that he learned there really came into helping him in with COVID-19. He used
Yeah.
a lot of those same skills, so
Yeah.
that makes a lot of sense.
Yeah. And
Definitely.
then like for me personally, we had a Hurricane Hugo in 1989 in this area in South Carolina, ruined our house, ruined everything, and our practice, still was there. We would help. I mean, I worked in the practice, but I was out of college at the time. But we'd meet people at the street. We'd meet people outside. When I
Yeah,
lived in Florida in '05, I went through 4 different hurricanes and lost my practice without electricity for 3 weeks. So we learned how to reinvent. We went down to
yeah,
the Publix and took the blood pressure and all. So during this pandemic, how can we do it? I've met patients in the parking lot. Like we've drawn their blood. Met them in the car. We've gone out, back out to the houses, the telehealth.
yeah,
The big difference, obviously, is those hurricanes, they might affect you, lost material things, but you weren't worried about your own health. COVID, you're so worried about your family, your own health. Every patient you see, every encounter you have is against your own health. And that
yeah.
is the very big difference now. And again, mine is very different, but because I had COVID at the very beginning and I went through almost 4 to 5 weeks in my bedroom by myself with no interaction except for this, not seeing my family or anything because we were so scared that they would get it. And we did everything we could, and thank goodness they didn't get it. But that was because there was nothing back then. I mean, it was one
Right.
of the first cases. So
Yeah,
and nobody knew. It was very different.
sure.
Yeah, but I think we could take those just to get back, and I know you're trying to get that, those instances of where we can look back and move forward on how can we go forward and still practice good medicine, still good preventive, and still help, you know.
No, you've actually, I think, answered a few of my questions I was going to ask you. So I'm going to jump ahead and ask overall, what have you learned through this pandemic? Big takeaway.
Wow. Um, I think the two of the big takeaways is I think we have to be prepared for another one. And this is not going to be the last one, hopefully the
Yeah,
last one a little bit, but even on this one, it's changed. I think the other big takeaway is to really take care of personally myself and burnout. I mean, you can only help so many people.
yes,
I also think for me personally that there's a bigger impact that we can in the forefront by this or interviews or writing the papers that we can try to do. Um, uh, I guess too is that more for the physicians or family physicians, let's hope in the future if there's a place more for us at, let's see, with the pharmacies or with the insurance companies or with these big groups, because I feel like a lot of the physicians might feel a little left out. They're going to the pharmacy for their vaccine instead of the local family physician's office for
sure.
whatever reason. So that's a little different. But I have great hope. Unfortunately, I think there's going to be a lot of suffering. There's already suffering, going to be more suffering. But I think out of that suffering, I think we will rise to new heights and new things. We just celebrated the September 11th and all things like that. I think it's obviously it's a moving target. We don't know the implications of telehealth excuse me, virtual learning with the kids, um, or staying at home and mental health. And it's not one size fits all, right?
No,
We're definitely not. Other doctors or people do very well with telehealth and embraced it. Other doctors don't.
Yeah,
Telehealth isn't the answer for everything. I know that much. And I think some of it too is to get back to the roots of listening to people, seeing people, being there, touching people. I think that's important.
sure. Who are the people you've worked with most closely during the pandemic, and who impressed you most during the pandemic, and why?
Yeah. Well, of course, I've worked with my own physicians, within my practice. One's my father, and then the area in the hospital. Um, I think I've also met a lot of great physicians working with physician burnout and different things. So I look at a couple of big leaders looking with different groups. Um, I will say at this time in family medicine, as I really look to a lot of the, like our current family medicine president, Dr. Ada Stewart, who I know
Yes.
personally, I look at her and Dr. Jerry Harmon, who's the AMA president, family medicine. I look at
Yeah.
like how their expertise of being a clinician at these, I want to say political or governmental arenas, like how they're really trying to work, or their groups behind the scenes helping. I think that's, I've been impressed at. Even and I will say, I'm going to say I'm just impressed with every physician that's out in the front line, the ICU doctors, that whatever. I can't, you know, them doing that, sharing information. I think that's exciting, important. I mean, I guess for me, especially since I had COVID back last year at the beginning, there were nobody in my community, nobody doctor had it. Nobody even knew about it. So I was
Yeah.
relying a lot on the internet for my colleagues in New York and Seattle and Europe and Italy. And, I look at all those people, those heroes that were willing to share, the heroes that got up and that have fought for the doctors for PPE. And it's almost all of us have, we did, to protect
Yeah.
our healthcare workers, not just the doctors. And these are the people that I think are amazing. I mean, even a couple of weekends ago, I had to go to the Department of Health, the people that are out there swabbing people every day, and the people, there's so many heroes and wonderful people that we've worked with. And I think that unfortunately, I don't believe that the average person realizes how interworking we are, especially even working with the schools and the health and all.
Are there any views on important issues in the specialty related to COVID-19 that we've not addressed that you'd like to share? Anything we haven't touched?
Yeah. Yeah, I think one of the biggest things, and I was reflecting back on it, is I I would really like that, let's say the pharmacy does the testing, right? Or the DHEC does the testing, or even my own place does the testing, or you do your own testing. What I've tried to get out would be nice if somebody said, do the testing, now get with a family medicine doctor, get in medicine, because you could do the testing, but testing in itself, you have to think of the context, where you
Yeah.
exposed, how you're exposed, what you're feeling, what you did. So I think that's a very big thing. I also would really hope that the insurance companies and the governmental politics, governing board, schools, I really would hope and wish that they would lean more to physicians for scientific evidence to help understand, so we could all be safe. That's what I think going forward. I think there's a big movement with physicians, the family physicians. There's a big group, the physicians mom group, getting out there, because we're also the parents and we're the sending our kids. So not only do we go to school, I mean, excuse me, go to work, then we're worried about our kids in the schools not vaccinated and no
Yeah.
mask mandate. And I think that is a shame. And I think that we're going to have a lot of lessons. I would love to, definitely, you could interview us another 3 months, or a year. It would
Yeah.
be very interesting to
Yeah.
see. I think a lot of the physicians getting out there and trying to say stuff, a lot of us are worried or scared because of the political backlash of it. But I
Yeah,
think it's more the groups, which we have seen have come together, and I would like to see more of that. Say the emergency medicine with Academy of Family Medicine, pediatrics, the American Medical Association, their basic core values to get together to help us as a whole. And I could see
yeah,
that as going forward as an elevation to help bring us together. We're all human, no matter what your racial um, ethnicity is, your economic, social impact. And I didn't even talk about that. That's another whole thing you could talk about, is how is it's changed, or brought out a lot of the problems and the inequality that we already had in medicine, or we already had in schools, things that
yeah,
we've been talking about. And this is just brought to light. And I think there've been a lot of great changes, with it. And I think looking back to starting from even the beginning of medicine, before I was even a family medicine doctor, when to look at the medical schools, how are they run? Looking at wellness, looking at good health, taking care of that. How can we prevent every disease? How can we prevent, more diabetes and all, not just a pill? Why don't we look at
yeah,
wellness? And I think that's the great thing I see that's going to be coming, you know, hopefully in the next, few years or generations, that I will see will be, hopefully will be there, and somebody would look back and say, aha, wow, let's do it. I would
yeah,
love to see hospitals be only a place that you go for surgery when you need to, not for all the heart attacks. I mean, of course, yes, you have it, but not, first let's look at wellness centers and fitness centers and mental health and things like that. And
yeah,
also, I guess with the pandemic is the mental health aspect, like telehealth, like trying to get back with being in the forefront and looking at whatever it's the physicians, the students, the patients, but really developing different backbones that help weave and intercept. So when people want help, they can get help. It's not waiting
yeah,
3 months to see a specialist or a
yeah.
psychiatrist or psychologist. And I think we need to get out, or seeing a family medicine doctor, you know. I think we need to get out of that. Um and I think there's some great opportunities about that.
All great thoughts. Any last thoughts you'd like to add? This is your opportunity to share your thoughts with future generations listening to this, or
Yeah.
set the record straight on anything you feel might be important to address.
Yeah. I think it just kind of says a lot of the same things. I think as more physicians, unfortunately, that did have COVID, and unfortunately, my colleagues, unlike me, that survived COVID, that passed away. I think if we could look at their stories, some of them are on Facebook and all, and see how, you know, how we can do better to help the next person. I think that's important. I really would like to see like I said, the insurance companies and different people realize the value of family medicine, how we can prevent this, how to ask us to be leaders. We are already leaders. Let us to be more leaders at the table to
Yeah,
help. I think that's very important. I also think to realize our worth. We um, went through. Now we need everybody on the health team, right? We need everybody, from the receptionist to the transporter to the nurse to the radiology tech to
yeah,
the cafeteria. We need
yeah,
everybody. But I think we also need to realize that we need the leadership and the physicians, and realize there is a difference in the education of a family medicine physician, or training, or any physician that goes through 4 years of regular college in the United States at least, and then 4 years of medical school, and then 3 years minimum of residency. How many hours that is come into play, where somebody, I do not believe that we can equate ourselves the same as somebody just getting out of school. It's like what you don't know. Um, and I think it's important in this sense that, look, doctors would like to, again, talk to people or answer emails and all, but I think we should be compensated for it.
oh
We
yeah,
have a lot of knowledge. We're willing to share it. Um, but I think we need to look onto it. I know there's a big push for quality, and I think that's very important, and I've been excited about that. But I hope it's more for a good of, you know, helping, like I tell my staff and my patients, is not just getting those 5 stars, the quality, right? To make sure
Yeah.
you have your mammogram and all. This is a person. Has somebody really talked to them about how that one mammogram could save their life, that one colonoscopy? So I think that's important, and there's a lot of opportunity for that, especially for family physicians. I hope that it comes back to the core value and not dispersed by, getting testing at the pharmacy, getting your vaccine at the pharmacy, or the pharmacist or the insurance company does. I hope it's
Yeah.
coming together. And I hope that the innovators that are out there, that I'm involved with some of them, are looking at the, for physicians to use our mind and our intelligence and our expertise at the top. And they say the top of your ladder. I could see maybe 100 patients a day. You just asked me, and I figured out what I get bogged down with, and a lot of physicians, is the electronic medical records. We didn't
Yeah.
go to medical school to heal. I mean, we went to for many different reasons, but to heal people and do it. And you have, physicians that are out there that are been practicing for 40 years, 30 years, and they just want to give up because of the electronic medical records. And I wish there's a way with technology or Siri or whatever that everything's there so the physician can get back to seeing that patient, diagnosing, getting it done and all. Because that's
Yeah.
what the years of training do to our brain. We've been trained for so many years. Somebody presents, you can say it's this, 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 and this, get it in. But what takes away from that is to type, 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 type that. And I'm thinking with everything, it's going to be kind of like, I'm kind of excited, kind of like Star Trek, right? Like you get the wand and it's like, oh, here's your blood sugar. We have that now. Here's the thing, you get this, here's the x-ray, here's the ultrasound. It's all in there. And I think a little bit of the artificial intelligence will come. However, it should not replace the doctor, but you might be able to put in, they have now all the logarithms. These are my symptoms. What do I have? You know,
Yeah.
um, but not taking away from the human touch and all.
Yeah.
So many CAT scans or things. It's like you still come in, you feel a mass, or you see something different. So,
Yeah. That
so
makes
that's
total sense.
that's mainly it. And I hope we also, besides the physicians, that are practicing, that we really embrace the medical students that are there, that we really embrace the disparities with women and different social, economic, and ethnicity issues, and highlight these students at a young age to make it better. I mean, it shouldn't be, oh, I'm a family physician. Do you want your child to be a doctor? No way. And unfortunately, that's how it was and is. Lately, but I see a new thing that's coming is that some of they say now more people are trying to get into medicine because of the pandemic. They see their family suffering. They want to get and make a difference. And I think if we have a great background and listen to these young people and help elevate them and get them so that we see more doctors like them, so they can go into their neighborhoods, wherever they are, in the city, in the rural country, whatever, and reach out to the community and really help. So you say, wow, look at that person, they were a doctor like that. And I think that's important. And there are a lot of great people doing wonderful podcasts. You guys doing this, that's out there, YouTube, Facebook. The people say, hey, it's exciting time. Let's put the science and the technology with the skill of the surgeon or the family medicine doctor for prevention, or their skill. And I think it's exciting. And then the invention with medicines. I mean, medicines, we need medicine, right? But looking at how in the future, maybe you take a ibuprofen, I take a ibuprofen, but they're totally different because now we found out more our bodies are different.
Yeah.
So that's exciting. And I hope that also the people that listen to this, whoever it is, the medical students or people in family medicine residency, that they get involved with the foundation and the Academy of Family Medicine and help promote that and be out there and be a voice. And I think
Sure.
people realize that they can be a voice for the goodness of all.
Well, thank you.
Yeah.
If you have nothing else to add, I'll go ahead and conclude our interview. And thank you so much for your time, and doing this and sharing your experience with the pandemic.
Yeah. You're welcome. I would like, if you just have a few minutes, Crystal, I think one